The 10 essential services provide a framework for public health infrastructure to protect and promote the health of all people in all communities. We will illustrate each of the 10 essential services to overcome the Healthy People 2020 trend that minority populations are more likely to be affected by type 2 diabetes. The first service is to assess and monitor the population's health status. Minority populations under the age of 30 have a higher prevalence of type 2 diabetes. The CDC will give this data to high minority percentage communities and their leaders who will use it to create programs and monitor their community's health. The second service is to investigate and address health problems affecting minority populations. Minority groups contribute to 25% of all adult patients with diabetes in the U.S. and represent the majority of children and adolescents with type 2 diabetes.
The third service is to communicate effectively to inform and educate people. Many district health departments provide education programs to their community. Cities can make diabetes prevention programs available to minorities. We can work with community partners such as hospitals, libraries, and churches to provide diabetes education in our community. The fourth essential service is to strengthen, support, and mobilize communities and partnerships to improve health. Cities can form official diabetes patient advocacy coalitions, DPAC, which are alliances of people with diabetes, health professionals, disease organizations, and companies, working collaboratively to promote public policy initiatives to improve the health of people with diabetes all across these minority populations.
The fifth service is to create, champion, and implement policies, plans, and laws that impact health. Cities must enact the plan by the CDC and the National Diabetes Prevention Program, which provides early health care to diagnose prediabetes and delay type 2. In addition, the CDC will refund organizations that provide access to testing in underprivileged communities. Cities can also enact the Native Diabetes Wellness Program plan of respectfully acknowledging a cross between cultures and newer Western medicine while explaining the importance of proper diet and exercise to minority population clinics. The sixth service is to utilize legal and regulatory actions designed to improve and protect the public's health. Cities can require all members to join the Affordable Care Act health insurance, which will increase accessibility both financially and logistically to millions of Americans if they do not have insurance. These health policies are crucial to prevent type 2 diabetes from developing if detected early during doctor visits.
The seventh service is to assure an effective system that enables equitable access to the individual services and care needed to be healthy. If left untreated, diabetes can lead to a host of devastating complications such as heart disease, blindness, nerve damage, kidney failure, and amputation. The eighth service is to build and support a diverse and skilled public health workforce. Clinics must nurture their employees to be as inclusive as possible and make selection criteria and the hiring process more transparent. In addition, they can remove personally identifiable information on applications, such as gender, race, age, etc., in order to handle patients' diagnosis and prognosis without personal bias. Lastly, it is important to enact specialized training for directors and staff in the handling of type 2 diabetes patients, specifically those from minority populations.
The ninth service is to improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. Professional advice for avoiding the onset of diabetes and how to best approach care is available online for all minority populations. The Office of Minority Health and Health Equity is taking part in awareness and care by working with minority communities and paying for research.
The 10th service is to build and maintain strong organizational infrastructure for public health. By effectively maintaining public health policies, cities and clinics can continue to prevent type 2 diabetes from affecting minority populations. Researchers can create and establish technologies that ensure minority populations have access to the same resources as the rest of the country. Once these 10 steps are enacted, they produce success in preventing the unequal health status of type 2 diabetes among minority populations across the United States.